thought you were going to find music, Christy. You know, it's the awkward pause before we all get started, isn't it?
Oh. Yeah. Hi, everybody. Great to see you. Thanks for joining us for the July Learning Collaborative.
Hello.
Hillary,
I think there's a request for a duet. I don't know. Are you all singers? Do you sing? And we love singers. Are you singers?
You don't want to hear that from me. I guarantee it.
All right, should we get started? Hillary, do you want to take off the introduction for this one?
Yeah, that's just, I can see some council members arriving, so let's
I've
just.
got that, Hillary.
Okay.
Let them in.
I was just like, so we don't repeat ourselves. Welcome. This is the July System of Care Learning Collaborative. For those of you who don't always come to this meeting once a month, we offer this learning collaborative space for folks who just want to go a little bit deeper on system of care. We've had lots of different presentations, themes, conversations over time. Last month, we had a lovely conversation around youth engagement from Youth Era. And so this month, we're really pleased to have the folks from the University of Connecticut, the Institute there, join us. They are one of our 2 TA partners for this year, in addition to Oregon Family Support Network and Youth Era. So want to recognize we're in partnership with them. And then also Trauma Informed Oregon. And I see Stefani from Trauma Informed Oregon has also joined us today. So thanks for being here, Stefani. And so, but today's focus is on the Institute. And so I want to introduce you to Denise, who's going to take it away from here and explain all things.
Great. Thank you, Hillary. Thank you, everyone, for having us today. My name is Denise Solzbach. I am with the Innovations Institute at the University of Connecticut. I am the director of the National Center, so that extends to our System of Care Technical Assistance arm. And Kim's with me today, and she'll introduce herself in a moment. Some of you may or may not be familiar with us in our prior life. We have operated out of the University of Maryland for over 15 years as the Institute for Innovation and Implementation, and the National Center all moved on, let's see, Kim, it was December 29th of 2022. So our national portfolio moved over to the University of Connecticut. My background is while we were at the University of Maryland, we did operate SAMHSA's National Technical Assistance Center for Child and Family Mental Health. So that included all of the system of care grants that SAMHSA let out, as well as for 5 years, we called it Technical Assistance to the World. So it was beyond system of care grantees. So we operated that contract for 8 years. And I have been in the role prior to that. I was a system of care project director for several grants in Maryland. In a former life, I was a prosecutor for juvenile cases, and I was also housed in a child advocacy center where I investigated child abuse. And that's where I first started seeing how our systems really set our children and families up for failure. So thank you so much for having us today. We would look forward to working with all of you. We're going to introduce a tool that Kim and I are 2 of the developers on, and we hope that you'll dig right in with us. So with that, Kim, would you like to introduce yourself, please?
Sure. I am Kim Eastup. I am also at the Innovations Institute at the University of Connecticut with my partner in crime, I like to say, which is funny because she was a prosecutor. Anyway, maybe it's just funny to us. Maybe I'm just a little corny. I don't know, like whichever. Just bear with me a little bit with my silly jokes. And I am faculty there. I think I said that already though, but I am the director for implementation, systems design and workforce development at the Innovations Institute. And we're very, very excited to talk to you today about some of the things that Denise and I geek out about. What is also funny is I've heard Denise give her backstory like 1,000 times, and it just hit me that I too started at a child advocacy center, and I was doing a lot of work, but on the flip side, and doing a lot of forensic interviews. And I was a clinician in a former life. And I like to say I'm a reformed clinician, but no offense to all of those lovely clinicians out there. I'll have to tell you that story some other time. But I too, that was the moment when I was like, whew, this is rough. Like these, and even though the child advocacy centers kind of came to be in a way to make things better, you could still see a lot of the holes and a lot of the things that needed to change. So I don't know why I never even really thought about that, Denise. Like we could have been partnered together in another
We
life.
could have. Other sides of Maryland.
Yeah, and I do believe that Innovations is 18 years old this month, right, Denise?
I believe our birthday is next week.
Oh, next week. Oh, I missed that mark. But Denise and I have actually been working together for a really long time. We've been with the Innovations Institute for a long time. I've been there for almost 16 years now. And I know Denise is about the same tenure there. So we get to partner with a lot of states around the country, and we're very excited to talk to you today about, some fun things like implementation science and all those things. Don't worry, that I know people might have glossed over, they might have rolled their eyes a little bit if I could see them, but we'll try to make it fun.
Our goal is to get you to geek out over implementation science like we do. You can let us know later how we do.
I know, and I'll try to tamp down my silly jokes, but it might happen. Just let me warn you. So I'm going to go ahead and share my screen. We do have a presentation to share with you all today, and let me move you over here. But again, like I said, if you all want to type in the chat, I don't know, Denise and Anna and Christy, I can't see anything anymore now that I'm sharing my screen. So just jump in and tell me to stop talking.
We're getting kudos for nerdy humor. So thank you, Alicia.
Appreciate it.
Call out chats if it feels like you're missing them. Throughout the presentation. And I just want to sort of, and maybe you'll do this, but sort of set the frame for folks, because we have tribal partners here, we have state council members here, and we have local system coordinators here. So this is an overview of the Yukon Technical Assistance Grant that we are engaging in for the next year. The statewide system of care will be, fully participating, and any of the other partners who are in the room may opt into participating in this process. You are not mandated to, but we do hope that you'll choose to join us in this assessment and improvement work that we'll be doing with the Institute, because the more alignment we have between the state and the tribes and the locals, then the better we will be doing for the youth who and the families who don't need to know where they're getting the services or who's doing the coordination work. They just need the services to work.
That's great. Thank you, Anna, so much for that. So we're going to dig right in and acknowledge some of the work, that you all are undertaking. And for youth and young people and their families, I just want to go ahead and make a blanket statement that sometimes I'm going to slip into just saying families, and I'm not going to acknowledge that families encompass children, youth, young people, caregivers, parents. It could be grandparents. Families are how we define them. And so I will just know that when I'm talking about families, that I'm not excluding anyone, and really honoring that families can look any number of ways, and that it does include the youth, the caregivers, parents, young people, children, and so on, grandparents, aunts, uncles, whomever people would like to include as part of their immediate family. And so I just want to put that out there, that I might slip in that space. But I wanted to start with acknowledging for families that pathways to help are not always easy, and they're certainly not always helpful, which is silly, right? Like, we want help to be helpful, but it doesn't always work that way. And it doesn't work that way in part because of the way systems are structured. And that's kind of what we're here to talk about, is how do we make things better and how do we fix things so that families can get what they want, when they want, how they want. And so what we know is that sometimes systems tend to rely on fail-first approaches. Sounds really weird. Like, it's not intentional. It's not that systems sit, in their government offices and they're like, whew, how can we set this up so that it doesn't work? There's a lot of factors that come into play, and there's nobody who's sitting there really doing that. It's the way historically, I think, things have been built that just don't work, and they're not easy to change. And so when we talk about fail-first approaches, it means that if a family has identified an issue, or they've said, whew, I can't manage this on my own, I need help, that their sense of urgency and need is sometimes not matched with what they are able to access based on either prior history or, the severity of the issue, that how families are defining urgency may not be the same way that the system is defining urgency. And so sometimes those things get put in place where families really have to try something knowing that they've already tried it, it didn't work, or they think something else would be helpful, but there's all these steps and you kind of have to figure out, like, where is it that I need to go first in order to get those things that are going to be helpful. And then sometimes systems are planning around solutions for needs that haven't really been named. It's like, oh, we need to expand our service array. Well, that may be true, but there are so many options. And so how do we pause and let's name the actual need so that we can build out the systems in ways that are meaningful for families? And then sometimes there are really good ideas put on the table. They are amazing ideas, but they're not fully funded, or they're not supported to quality or fidelity of the practice. And then what we know is that for systems change to be meaningful and helpful, we have to make sure that care standards are established, that they're monitored, and that they're changed regularly when there's challenges or barriers that are coming up. And we've already heard from some of you and some of the locals on how those family barriers are being addressed. But from the system perspective, it's not only monitoring who gets in or how many got this particular thing and what their outcomes were. We've got to check in on who doesn't have access, who's getting excluded from this process, because that is almost more important than who gets in if we want to think about equity and we want to think about accessibility and making sure that no matter the region or the geographic area, where families are, where they're needing help, that we're not only tracking who gets in, but who doesn't get in. And we've got to find a way to monitor those so that we can envision a system where families get what they need, when they need it, and where they need it. And the really cool thing about Oregon is you've started this work, right? Like, the state has implemented your System of Care Advisory Council. There's a Senate Bill 1 and Senate Bill 4. And I know you all are very familiar with this, but we wanted to acknowledge that this is progress. There's so many states that don't have this kind of structure in place, this kind of support to give feedback and to play the role that your SOCAC. Am I saying that right? I feel like I'm really pronouncing the C's, but I just want to make sure that I'm doing that.
That's because
right.
we also have SOCAT in Tennessee.
I know,
so we kind of
Tennessee.
shift the language a little bit.
Yeah. SOCAC. Is that right, Anna? We're good.
We got a thumbs up.
It's a little awkward, but you get used to it and then it just rolls off the tongue.
No, I have to also admit that I grew up in Georgia, and so sometimes my Southern comes out. It's been a long time since I've been there. But when I say SOCAC, I'm like, oh, that's like some kind of, something that my grandpa used to say. I don't know what it is, but again, corny, I'm sorry, silly, whatever.
But it's not as bad as my Boston accent. I talk to Pat, especially when I get tired. So I apologize in advance for my
it is so true.
Home-rooted accents. All right.
Go ahead, Denise.
Nope, let's go on to the next and show them all
okay.
the great stuff that we've read.
Okay. So we also know that your SOCAC has established vision and outcomes for your system of care in Oregon. And I think, I mean, I have to give props for, I mean, it's very clear, it's straightforward, right? That all young people from all backgrounds are healthy, safe, learning, and thriving in their homes and communities. And of course, we want all families to experience that. And then you've established outcomes which really align with the kind of big three, right? That are our families together, our young people in their homes and communities and out of trouble and in school. I think I said three big and then I made it four, but two of those kind of go together. But there's still, we want to honor the work that's been done, the vision and the outcomes that have been established, and really help you all actualize a lot of these, or hopefully that's what we hope anyway. We also saw as part of the plan that there was a lot of feedback from, again, young people, youth and caregivers, parents, families, and that families characterized some of the needs around not knowing where to go, not having access to a centralized source of information, lack of communication within and between systems, telling their stories over and over again, that lag time between identifying the need for the service and getting it, so that aligned sense of urgency. And these are all things that I think we hear across the country. And, that doesn't necessarily help families feel better about it. But what I will say is that we can actually address these. We can start to move forward to work on some of these things. And so also in your strategic plan, as you all were trying to address those pieces, there were 4 pillars that are really the foundation for the work that was laid out in your strategic plan. Again, I won't read those to you, but it's, the really foundational, really super important work of youth and families being full partners across all levels of the system, that needs and services are matched, not only in here's what I need and here's a support that directly aligns, but that sense of urgency is also met, that we're addressing eligibility, we're addressing really long wait lists, wait times to get in, the hoops that families have to jump through, and that those services and supports are available and reflect what it is that the family's saying would be important for them. So those were really cool. And then for each pillar, your strategic plan also outlined core objectives. And again, this couldn't align more beautifully with some of this work around the system transformation and implementation science and so on. And a lot of those pieces have been defined and outlined really nicely around the 4 pillars and really closely aligned with this. And so I hope that as we go through and we start explaining some of this, you'll see where some of those alignments are, and then you could share those with us. So then how do we bridge the gap? So we know that the current experience may not be what we hope, that outcomes may not be as robust or positive as we would hope, that there's high utilization of out-of-home care, that there's not access to quality services and supports, there could be high costs, system silos, access, disparities, for sure. But we also know what the desired experience is. And I think the strategic plan outlines, again, very nicely what we hope things could be, which is easy access, that families can get what they want when they want, that includes evidence-based practice and care standards, that care is coordinated and, across systems, and honestly, that it's helpful. I mean, imagine that, help being helpful. That should just be our goal all the time, is that help is helpful. And so how do we get there? What is the bridge between the current experience and the desired experience? And so this is where we want to focus a lot of our conversation today, is on that implementation science, because we know that there's actually a better way to do things. There's a ton, if there's anything that's been researched and shown over and over and over and over again, it's that if we're going through a transformation, that there are better ways to do the work. And so care pathways are youth and caregiver guided, they're outcome based, driven by best practices, and informed by implementation science, where we're providing the right time and place for services and supports. The data are shared and monitored. And that's how we're going to go from the current experience to the desired experience. So in the system of care components, which I know all of you are very, very familiar with, but we have one kind of point to make here, that there's a value base, that foundation to all system of care work is that it really does sit in a value base of youth and parent partnership, that their voices are heard, that the choices, the things that they're saying they need, that we're hearing that and we're reacting to it and trying to make things better, that we're committing to community-based options. And it's not only because, children thrive there, but we also know the alternatives aren't great. Like, data is very clear too, that when we pull young people out of their homes and communities, outcomes are really hard to achieve at that point. And that we're partnering with families from a lens of cultural humility, that we don't understand everything about everybody. And that, when we meet one family, we've met one family, and every family is unique. And so we're building from that value base. And historically, the value speak has been substituted for concrete behavior change and practice. And families want to see action, like they want more than a value base. And so values are a great, great starting place. It's the foundation of the work that we're doing. It's uber important, but we've got to continue and move beyond it to make sure that our system has core components that work for families, that include things like financing structures, care coordination models, a really robust evidence-informed service array, mobile response and stabilization, that we're collecting data constantly, and we're using that information to guide decisions and to pivot, and that there's a governance structure that's overseeing it, that doesn't stop. It's not a one and done kind of thing, that we're continually paying attention, with the hope that we have a system that is equitable and inclusive and trauma informed, that we have continuous quality improvement aspects to it, and also that we're monitoring outcomes, and that the system is balanced between the services and supports, the deep end, the community-based options. And again, that families are saying, things are better because of my support that I received, or the services that I accessed. And so what gets in the way? I think we can all agree on these things, but what is it that gets in the way of this, being able to move forward? Why is it so hard sometimes? And I think that despite good intentions, that sometimes we still are working in silos, that there are small work groups or specific system control around certain pieces of plans, that new initiatives and mandates are always coming at us, right? That we have to pivot and respond to things, that there's a lack of authority to operationalize a strategy, that we just don't have quite, the right levers that we can push, and that there's no clear pathway for things to happen. And that makes it hard. So, there's this idea of shared ownership across systems. But I know that for a lot of you out there, and strategic planning is ongoing, that how many of you have participated as part of strategic plans, or sat in the different agencies or organizations, and then that strategic plan, no matter how many people were around the table, then becomes the sole responsibility of that single agency? Just pop in the chat. Like, how many of you have been part of those processes where, the actual pulling together of it might have been cross-agency or cross-system, but, when it gets down to it.
Getting some oh yeahs, some clapping. We see this in every state.
Mm-hmm. Yeah.
Or nobody's responsibility, right, Dan? Mm-hmm.
Absolutely. Absolutely. And sometimes in these processes too, it's actually mandated. Denise and I were working with the state the other day that in the same process, and they're a little bit further down the road than you all are. And we were having a conversation with them, and suddenly they were like, oh yeah, it's strategic planning time again. And I'm like, what? Wait a minute, we're going through this whole thing. And they're like, yeah, but it's legislated. Like, we got to do it. And it's those kinds of things that we have to pause and think, goodness, what are we trying to do? And how do these things get legislated in a way that don't actually support the work we want to do, where we want everyone to come together, not necessarily around a problem, but around a shared population of focus, recognizing that all of Oregon's young people, children, are Oregon's young people and children, that there's families that we're sharing this population across agencies and so on.
And Kim, I just want to add that shared population of focus, the majority of those youth have behavioral health needs, right? However, the ownership is to be across systems. It's not systems of care if the ownership lies solely with the Behavioral Health Authority or those agencies or entities.
Yeah, good point. All right, so let me just recap. So we're making sure, or we're setting our goals around being helpful, which I think is something we should all strive for, that we're all going to come together and do this work around a shared population. And so I want to shift and talk about this process of implementation science, and what does this actually mean, and how does it apply to the work that we're doing at the system level, be it the state or the local, right, to address some of these challenges, and also to make sure that we're relevant and we're doing the things that are needed. And so we want to start our system transformation efforts with identifying the need. I apologize. There's an ice cream person out, and the dog is going crazy now because the ice cream person is outside, and there are children. So apologies for that. I know now everybody's like, I want ice cream. I want ice cream.
Kim and I both have barking dogs named Finn. We should just not name them Finn.
So our system transformation, we want to make sure that we're identifying the need. And I know that families are really articulate, young people are articulate about what those needs are. And as a system, we need to dig in a little bit and ask ourselves, like, how do we know, and are we ready for this change? And we need to be very clear what it is that we're trying to address, that we're not just saying like, oh, things are really hard. Well, things are really hard, but we need to drill in just a little bit around that. And so once we've identified the need, and we've gathered some data, and we know that this is a problem, and we've got people to come together to say we are ready for change. We know that things need to happen, and we're ready to roll up our sleeves and get this work done. We want to then move to our outcomes. So if this need is met, what's going to be different? And it could be a huge, array of things, from skilled workforce to a comprehensive provider network, that families are together, that families are saying, whew, things are better, I'm feeling good, whatever it might be, right? We just want to make sure the outcomes are aligned with the named need. And then really, really important is that we're assessing fit, that we want to make sure that whatever intervention or reform or transformation that we're undertaking, that thing that we're going to do is actually going to impact the need, like it's going to address the need, and we're going to achieve the outcomes for that. And then along the way, we have some outer setting things that we need to attend to, like we can't get a lot done if we don't pay attention to financing and policy, population needs, leadership, and so on. But also the inner setting of what are the provider types, if any. Maybe it's a workforce development issue, maybe it's a data issue, maybe it's quality, fidelity, whatever that might be. We want to pay attention to that. And then we have those bridging factors, which what are the partnerships that are needed, and how do we close the gap between policy and practice to make those changes come to life? Denise, did you want to add anything there before you're muted?
Sorry, it's just because I anticipated a dog barking. What we do want to emphasize with the implementation science wheel is it's an organizing framework, and it helps become that glue. These are the factors that you have to pay attention to in order for strategic plans to be operational and to work effectively. And so it's a framework that we're using. We'll talk more about this with the tool, as it, rather than just picking strategies and throwing up against a wall, it's connecting them so that they're actually going to be the fit that we need in order to address those outcomes that we seek to achieve.
Mhm.
So there's science behind the implementation science wheel.
I know, right? And we need to be able to draw a line through three really important things. The first is that system transformation effort, that named need, and the how do we know. We have to have the data behind it. That's the only way we're going to know, like, one, are we addressing the right thing? And two, are things getting better? So if we don't check in around that, we're not going to know that. And that if the name need is met, what is going to be different? So what are those outcomes that are directly connected to what we're trying to address? And then that idea of fit, that the proposed strategies are going to impact the identified problem or population and make things better for families. And we need to be able to really draw a straight line through these things, and they all need to connect. So if you're reading, a strategy on a plan, but you're not really sure how it's going to achieve the vision or how it's going to connect to those pillars or how it's going to help you with those core objectives, then we may need to sit back and say, hold on, what's the fit here? Like, how do we, what are the opportunities to really align very concretely the need with the outcomes and the strategies that we're using to make change?
The other thing is, Kim and I are both trained in results accountability. I think I read some reference to that in some of your documents as well. And this very much aligns with results accountability as well. What will work? What's the fit? What's the reach?
And so I wanted to find another concept. We've talked, I think I've thrown around this word a couple of times already, the care pathway. People are probably like, what is that? But really, very concretely, it is families' experience to and through the system. And what we also saw as part of your strategic plan were the voices very clearly articulating that this is hard, that there's feelings that the system doesn't care about them, that they don't know where to go, that the system is feeding itself, that there's not a lot up front, that even when help does exist, it feels like, the best kept secret in the planet. And that is not actually what we want to happen. And as systems, we can change this experience. We can actually track and monitor systems experience, families' experiences to and through the system to make sure that we're being relevant, around those pieces. And so let me break it down another way. So when we think about the preferred care pathway for young people and their families, is that when something happens and they have reached out to their natural network, they've done whatever it is that's relevant for them, and they're like, this is a problem that we can't address and I need help. They're literally sitting there like, I need help. And so your first step is, well, how do I find it? Where do I go? Where do I look? I'm not really sure. And so maybe we Google, maybe we do some things to try and find services and supports. But then if they find something, are they eligible for it? And that's always like, the next hurdle that they have to jump through. And once they find it, and then they say, oh, look, I am eligible for it, do they get quick access to it? Or is there this long waiting list where we've identified a problem? We would like the urgency of response to match what we're experiencing as families, as family members. And then once we get in, we want that help to be helpful. And our outcomes, our life is better. things are actually going well, and we're doing well. We're doing things that families want to do and the things that are important to us. But for families to experience this pathway, right? So for this to actually work, where a problem happens, they know where to go to find help, they're eligible for it, they can get in quickly, and that when they get in, it's helpful and that things are better. The system has to work on a few things, that the system design has to be set up to support that there's regulation, policy, procedures, have we defined the appropriate population? Do we have the financing structures? Has the system set practice expectations, and is there oversight for that? And is there an ongoing CQI or return on investment that we can say, yeah, this is actually working? And then at the practice and community level, there's a responsibility there too, because they have to market this. There has to be an implementation team. There's procedures for how all of this works, that there's quality staffing, that there are people there to provide the support needed. That again, there's expert coaching if needed, there's practice expectations, data collection, monitoring, and that organizations are saying, yeah, we're asking families, did things get better? And what can we do better to change your experience? And we need all of these levels. And so if that's the desired pathway, if that's what we hope is working, that it's, beautifully orchestrated and aligned and, things are moving great, then we probably wouldn't be here. So we have to identify what we would call an interruption point, meaning where in that ideal pathway are things just not working? And so where does the system need to check in to say, whew, like here is where things might be breaking down. And so what you see on the screen are some gray boxes that is a very much an oversimplification of systems. But just bear with us for a second that, there's EPSDT, which is early periodic screening, diagnostic, is it diagnostic? It's not diagnosis, it's diagnostic and treatment. Diagnosis and treatment? It's close. That's close to what it is.
It's late here on the East Coast.
Yeah. I'm like, whew. So
early and periodic screening, diagnostic and treatment.
Yes, that. There's early identification of challenges, and this could be in a pediatrician's office and so on. Then we're moving into daycare settings and school, traditional outpatient services, maybe other system-specific services. And then at some point, there could be a need for an increased intensity of support. And if not, then they're going to continue with traditional services and supports. And if so, we're going to, there could potentially be some system involvement, meaning child welfare, juvenile justice, maybe, individualized education plans in schools, intensive in-home supports, inpatient hospitalization, and so on. And in this kind of rudimentary, outline of a system, we have to look at it and say, where can we change the experience for families? Where can we interrupt what the current pathway is to make a new experience so that we get better outcomes and that families can feel like, yes, this is helpful, and that we've intervened at the right time and place. And the interesting thing about mobile response and stabilization services and early childhood mental health consultation is that those things are ultimate interrupters and equalizers in a system, because when families call, we respond. And that could be the thing that puts them on a better pathway and prevents kind of this escalation in the system, and that they're getting the response. Everyone's getting it. No matter who calls, somebody is showing up. Denise, did you want to add anything about that?
Not about that. There was a question or comment about the importance of data measures, and common
Yes.
assessments.
Yes.
And I was looking ahead in our slides, and I don't believe we have the one with the family, youth and family pathway with all of the waves and the bubbles with the indicators, but we can get to that in a bit.
Yeah. So as systems are looking for where do we intervene, it seems daunting, right? To think about what are those places that we can change the experiences for families and create a new experience for them, because that's really what we're looking for. And so I want to talk about a little bit of an ideal or best practice of what that might look like for families, in that there is standardized screening and a holistic assessment. And that is not something that's put in place that's done to families. It's something that's done in partnership with youth, with young people, and with caregivers and parents, and that it's holistic, that we're looking at social determinants of health or social circumstances. We're looking at the family's history, their traditions, their preferences, and that families are able to voice what is important to them. And we're also looking at risk and, all of those kinds of things. And so it's really important that all families have access, right? And the interesting thing about this is that if that A can be put into a system, then the system can monitor, again, not only who is gaining access to what, but who is not. And you can track it by need, you can track it by all of these circumstances to make sure, again, that people are not being excluded, that certain populations of people are not being excluded, and that we all have the same access to the supports and services that are important for us. And so we're creating that shared understanding. We're using the results of the assessment and the voiced needs to look for options that are that best fit. Now, this is at the family level. So this is a little bit different than the fit that we were talking about before, but it's actually the same kind of fit. We're just talking about the family level instead of the system level, because again, we want to match what the family needs to what they get, which is not always the way that it happens, unfortunately. And then that plan of care is created, and that plan of care is monitored and adjusted, and that we're tracking outcomes. Not just did things happen, but did things get better? And so if we want this as kind of an ideal, way to set up that pathway for families, the system has to do a few things, right? So there has to be standardized tools that include self-report from families and young people, and caregivers and parents, that data are collected, that there's a reporting system where we can pull up and monitor this kind of on demand, and that, again, in that fit category, that the data systems are actually looking at the needs that have been assessed and the things that families are gaining access to, and is there alignment, that we're disaggregating these across minority groups or underserved populations so that we can track it, who's getting access and who's not, and why, so we can change that experience. Remember, that's kind of the point. And from a system perspective, that shared ownership and accountability with electronic health records, policies, financing structures, workforce standards, fidelity monitoring, and so on. And then that monitoring and adjusting. And so how do we kind of, zero in on these pathways and think, what are we tracking here? Like links of service. It was interesting the other day, I was reading, it was so interesting. I was reading Medicaid regs, right? Like CMS kind of Medicaid regs. And I was thinking about this, there's this whole push for evidence-based practices, right? Like evidence-based practices, evidence-based practices, evidence-based practices. And I was like, I read something about an extended code for a clinical service that needed to go beyond 60 minutes. And so I was thinking, again, you all are going to shake your head and roll your eyes, and that's okay because I can't see you. But but thinking about how do we as systems actually look and say, okay, if we're going to install and have this particular service or thing available for families, and that the evidence base shows that 90 minutes is the sweet spot, right? That each opportunity, each interaction is a 90-minute interaction. Are we actually looking at, are people billing 90 minutes? Are they using that extended code? Have we built out a code that accounts for that? And I thought, like, how many systems kind of pay attention to, are people getting what we hope they get? And again, it's just my little light reading there on Medicaid regulation. But it's an interesting thought, right? That I don't think that sometimes all of those dots get connected as we're thinking about care standards and how are we monitoring progress, that length of service or length of care, and are we disaggregating by those demographics that are important? The making sure, again, who not only who gets access, but who doesn't. And, is there a return on investment, successful transition, and satisfaction as part of the work that we're doing?
And speaking of connecting dots,
okay,
we have a separate scope of work with the Healthcare Authority where we're doing a Medicaid review. That's our finance and policy team that's taking a deep dive into your Medicaid estate plan and all the fun stuff that we geek out over to help us connect those dots. Alicia has in the chat box regarding exclusion, how do we navigate what we may call service or system gatekeepers? It's all about your system's design and why you have those positions in place and what your eligibility should look like in order to meet the needs of the family at the time they need it. Kim and I often say, and this is just striking, and Sandy and others can speak so much more eloquently to this than we can, but when a family actually calls the government for help, it's bad. And as systems leaders, we owe it to our families to make sure that we are paying attention to the care pathways that needed at that system and program level in order for that family and youth care pathway to be successful.
Yeah. Okay, so we've kind of set the stage around some really complicated things around implementation science and that, and care pathways, interruption points, like woo, that sounds like a lot of jargon. But really, I want us to boil it down to families' experiences to and through the system, and how do we as systems structure ourselves for families to access what they need, when they need, and how they need. And as a lot of states, not just Oregon, we're just speaking in general across the country, we notice that as people go into strategic planning sessions, that they do all the time, that we wondered, how do we enhance this process? How do we, if systems are going through transformation, whatever it is that's happening, how can we give them something that's like a gold standard to achieve and to kind of compare themselves to? And so we created what is called the System Report Support
Reform.
System Reform Support Instrument, the SRSI, that outlines modern system design components that is actually structured, and I'm going to show you this, structured across the stages of implementation, meaning that there's kind of a pre-implementation or readiness component, that there's an implementation. So we're actively working, we're digging in around some of that operationalization of those values, right? And that we're creating a system that can sustain through leadership changes, policy changes, and so on. And so this tool is designed to help system leaders assess and prioritize those indicators known to be associated with modern systems to improve outcomes for identified populations. Whew, that was a mouthful. That's what we did. And so just to break it down a little bit further, that we're comparing our current design to known indicators of a modern system, that we are looking across levels, so at the policy, the management, the practice, and community levels, as well as stages of implementation, to improve families' experiences and change the way systems do business. I know you all have probably seen this in many, many forms, but we can't do this work without doing it across all levels. So again, that policy, that management, frontline, and community levels, and they're all equally important. And it's certainly not easy, and we know that. We want to recognize that. I read something the other day that said someone interviewed people about change, and they were so bold as to say, people would just rather like die and go do something else than change. And I was like, really? That can't be true. It was a podcast or something. I don't know. It could have been, something really silly, but they said that change is really hard. And so we want to, recognize that, but it's also kind of confusing sometimes. And hopefully we've, kind of culled it down a little bit to demystify some of these things so that we can chunk it out and we can make it a little more digestible and easier to accomplish. Yes.
Before you move on to the next slide, Alicia added another question in the chat that feels like maybe this is a helpful slide to use to address it, or at least to talk about when and how we would address it. So her question was regarding the exclusion that you were talking about earlier, or the populations that are not able to access services. How do we navigate what could be called service or system gatekeepers? So that would be at the frontline practice and within the community levels in the system transformation work.
Yeah, that is a great, go ahead, Denise. Were you gonna?
Well, I think it goes back to your systems design and whether or not you have those gatekeepers and what's their purpose, right? We want to make sure, and Alicia, you also mentioned the assessments as well, and you see that on this screen. So it's talking about how do families and youth actually access that care pathway, and where, if any point in your system, it's appropriate to have those gatekeepers. As opposed to eligibility screening, we get them in. That screening, assessment, eligibility, and we get them on. We help families find the care pathway that meets their needs. Does that answer your question, Alicia? It's all in your system design.
Somewhat. I think it's more, and thank you for taking the question and trying to answer. And maybe this is something that we can kind of work on as we, meet more over the next year. But I think it's more in terms of families technically qualifying for services, but the system not necessarily seeing the families or a family as needing the service, if that makes any sense. And then therefore determining that, no, well, you're not eligible for this particular service. And I think that's kind of where I think my question really lies.
Yeah.
And I think in terms of the points of intervention, or where, if, and how or when we do have gatekeepers, I think one of the biggest issues or challenges that I have seen and observed is when you have when there are gatekeepers kind of on the higher level of the echelon, within the system. So it makes it really difficult to actually have oversight, because the people who are supposed to do the oversight are the ones that are the gatekeepers. So I think that's one of the questions that I would like to see us kind of work on over the next year.
Absolutely. Absolutely. I think your point is well taken too, in that if we're going to go through a transformation that fundamentally, I mean, think about this. Staff, those gatekeepers, if you will, have to have a new job assignment. That it's not gatekeeping, right? Like we have to redefine what that looks like. That instead of gatekeeping, maybe they are looking at data, right? And they're seeing that, oh, these families are being referred. Here are needs and, things that have popped up, and here's what they're getting. And is there alignment? Like that's a whole different job than gatekeeping. That's a whole different thing. And so how does systems start to, move around and be a little nimble, which I'm going to say this, and I know again, but systems being a little nimble in redefining the work that they're doing, which again, people aren't always comfortable with, but that's where the real transformation happens. Is that, we can't put out all of these goals and then everybody just keep working in the same way that they've been. I mean, I just don't know. I don't know how that works, without some of those changes.
Use of data and those standardized assessments remove the subjectivity. It's objective.
Yeah.
So when you slip into subjectivity and somebody else making a decision as to who gets what service, your disparate treatment is going to go off the charts, right?
Yeah.
One of the number one equalizers we see as far as accessing treatment and meeting families at the time when they need it, where they are, is mobile response and stabilization. It's the number one equalizer I would say I see in the nation right now. And Oregon is doing some great work in that. And we'd love to chat more with you about that another time too. Great questions. Karen, let me just call in the chat box. Karen's also saying, remember, resources cannot be just defined as mental health. Absolutely. We have to look at families holistically when evaluating their needs. We have all kinds of pretty trees and graphics on that, Karen, that we didn't put in this PowerPoint. Another day.
That's true. Another day we'll show you the trees. But it is true. I mean, it is not easy work, which is why I think, that sometimes states tend to, kind of work on the periphery because it is challenging. But it can also be exciting, and thinking about the impact that we can have. So across these levels, I also just want to add about assessment that we're not talking about a single tool. Like it's not, let's pull out a, child behavioral checklist or the Ohio scales or the child and adolescent needs and strengths assessment. We're not talking about like just picking one. We're talking about having a standardized approach to the work that could include one of those tools, but also include family self-report. And so again, looking at that data to say, wait a minute, is this kind of system assessment saying one thing and families saying another? Then we know we have like a workforce issue, right? That we need to figure out how to align those things. And it tells us something different, and it changes the way that we're responding to those components. And so the system report, I don't know, that's the word that's going to escape me tonight, is the System Reform Support Instrument, that SRSI. If anyone looked at it, don't be afraid. Don't be afraid. The manual is long. There's 108 indicators across 3 phases and all of these things. But the pre-implementation phase is only 40. That's a lot more manageable than 108. Implementation is only 42, and sustainability is 36. And so just knowing that when you start to break it down by the stages of implementation, so we need to look at a little, where are we at? Do we have all the things in place that we need to move things forward? That pre-implementation to implementation. And then are we creating sustainability and moving from implementation to that sustainment phase? And that there's some of those things, we've already looked at it. We've met with the state system of care folks, and we've gotten some documents, and we've gotten to have some preliminary conversations about it. And there are some things that you already have. So even of those 40 indicators, there's some things that are already there. And then there's some things that, we may need to pay attention to. And so, then we're prioritizing. And so we're really making that we're culling it down into a manageable group of indicators. And we're doing it with you all. And it's not a score, it's not a test, it's not an evaluation. It's just a way to help us focus on those things that we know improve outcomes for young people and their families. So this is just a snapshot of what the manual looks like, just to show you that each indicator has a definition. And again, we walk through this with you. It's not a hand it over and figure it out kind of thing. It's conversation. And it helps, again, narrow the focus of what we're trying to do. And that there's feedback reports that we can track progress over time. And this data that comes back can help us focus. And so what you'll see here is some data from another state. And in this example, you'll see that we actually co-scored, but we don't have to do it that way. I'm going to show you another example where, we just had a conversation, we scored together, and we're moving forward. But this just shows you, let's dig in around this, or let's dig in around that practice level. Let's dig in and look at the management, whatever it might be, that we can track that over time. And then each of those sections has subsections. And so then we can pull it down even further, right? Like if we were going to focus on the policy components and we kind of looked at the data, maybe we need to look at access and appropriate populations, right? Like maybe let's start there. Or maybe we want to capitalize on something that is, kind of in the works already, and we want to focus on leadership, whatever it might be. And then the other example is if we have the indicator, we can do this across time, and we can actually track progress of where are we, what is the improvement that's happened, whatever it might be. But it's just helpful to track over time and celebrate all of the successes for the hard work and how everyone is coming together. So then when we're using the SRSI, we can use it in one of two ways. We can start with, all right, we have a system design or transformation and innovation that we want to install. So let's approach it from that perspective. And then the other bucket is, there's a big problem. There's a big problem that we need to address. And we need to check in around that specifically. So in that system design or innovation, we're really looking at installing those system innovations, the strategic planning, building a comprehensive system of care. Or the other way around the curve is, that identified problem or issue. We're reacting maybe to legislative changes. We're responding to new mandates. There's a lawsuit or some kind of identified problem. But no matter which way you go around that wheel, or which direction you go on that road, at the end of the day, we want to make sure that we're gathering data, that we're getting information on an ongoing basis from families, and that they're able to say, yes, this was helpful. We're identifying interruption points, meaning we're changing the experience for families, and we're prioritizing indicators and working towards sustainability. That even if we're going after a problem, that we're addressing that problem with the lens of we need to fix the system so that this isn't a problem in the future, whichever way we choose. And so when we're thinking,
add, we didn't have the normal slide in here, one of our many normal slides. In scoring, you made the point that it's not a report card. It's not like a we got you anything. The ratings are 0, 1, or 2. 0, we're not working on it. 1, we're working on it, it's in progress, and 2, it's in place. And that's where you can see how you're moving across time, as well as it helps you prioritize your indicators. So if you have a lot of 0s or 1s in a particular area, then maybe that's where this local council is going to want to dig in and work on. And so our goal is to help identify common indicators that different local councils want to work on, as well as rolling that up and aligning it with where the SOCAC sees prioritization is needed or could be helpful. So sorry, I just want to put that in there.
Yeah, no, it's great. So when we're thinking about care pathways and we're almost to the end and we're opening it up for questions, we really want to understand what is it that families are experiencing, which I feel like is very well articulated already in the strategic plan. It was eloquently described in multiple ways from both young people and families, caregivers, and so on. but defining then that innovation or that problem to be resolved. And then what data support that? It doesn't mean, we're just looking for data that we can track in how we will know if things are getting better. So it's that family experience plus the data in the system to explore why the change is needed, that we're making sure that there's fit, because the first option is not always the best. It's not always the easiest option. And so again, that straight line that we're looking for between the need, the outcomes we hope to achieve, and the fit of the strategies or intervention. And then we're using the SRSI to identify areas for improvement. We're comparing ourselves to modern systems, and then we're strategically working to build those systems that work for families. And then that data then gets carried over to enhance the service array. That could be part of what we're looking at. Maybe there are workforce development needs, or it could be a combination of any of these things. Let me just say that. Maybe there are needed policy changes. Maybe data sharing needs to be enhanced or created, which, by the way, your data dashboards in Oregon are pretty impressive. And not many states have anything close to what you all have in that arena. That we're supporting the installation of new innovations, that we're looking at things that we want to enhance or make better, that we're tracking and addressing disparities in access and care and so on, that we're maintaining that progress that can withstand leadership changes. And this is so critical. There's another state that Denise and I are fortunate enough to partner with that all of their innovation really sits in some soft funding around grants. And so when you look at their ability to maintain over time and across leadership changes, governor changes, commissioner changes or secretary changes, whatever, it's really challenging, because a lot of the innovation and things that they are doing sit in grants that never then transition into those long-term sustainable pockets. And then we're celebrating those positive outcomes. And so I want to show you an example from another state, just so you can see like how it all came together in that, and using the SRSI indicators to prioritize the work. So in this particular state, when we did a care pathway analysis, what we found, meaning the data, right? This is what it gave back. And it showed that access to help and pathways to help were all over the place. Like, I mean, you all can imagine, right? There was no clear path to really much of anything. And actually the visual around that was quite striking. And data also showed that there were early discharges or transition from care despite the intensity of need being escalated and elevated a little bit. We also found that the mean age of service entry was 9, which could be younger or older than expected, but that was something that was important for this particular state to understand. And that young Black males were more likely to receive medication management in lieu of all other services, meaning that's the only thing they got was let's give them a pill. Very young children. That was what was happening. These were data that showed that. So we could track how families were going to and through the system and what they were gaining access to and what that looked like. Then there was also some focus groups and some family reports from the family organization and so on that mirrored very much the experiences that we saw in your strategic plan, that finding help was hard. Accessing the things that they thought would be helpful was just really hard, and that things have to get so bad before someone pays attention. And that was just not helpful. And so this group, so the strategies that you see in blue going down the road are not in order. It's not steps. These are big indicators that they chose to prioritize. And under each of these indicators were a series of strategies of how they were going to do it. So based on the data and the family experiences, they wanted to prioritize a standardized assessment process. There was nothing in the state. Everybody was kind of doing their own thing. Some, people were using data around standardized assessments. Some providers were not, but everybody's experience was different. And so that was a priority for them. They also wanted to check in around their eligibility criteria for services and supports for children under 10, because they saw that the mean age of service entry was 9, meaning the first time that a family hit the system was 9. And so they wanted to actually make sure, like, if we're going to expand our service array, we're going to look at these things. What do we even have available for these young people at 9? And what they found is that it wasn't so great. So they want to check in around that. Then they also wanted to create a data tracking system to make sure that they can track of that standardized assessment data that they were gathering, the fit and of utilization, and disaggregate that by race, because there were huge disparities in access and eligibility, and actually gaining entry into those evidence-based practices. And then as a system, they also wanted to install a comprehensive mobile response and stabilization service component, because that age of 9 is pretty young. Like, it could be a flashpoint. Things aren't perfect, and sometimes things happen, and we just want somebody to come and talk to us and help. And so they felt like that would be a huge way for them to impact their system and make meaningful changes. And so these 4 indicators were prioritized. And again, they had the strategies under each one that were unique to them, and recognizing that MRSS is that equalizer, because when families call, we show up, no matter, age, race, ethnicity, geographic location, all of those things. And so that was really important for them. And so the ongoing work then is a reminder that values are a great starting place, but we need to shift and make sure that those values are translated into behaviors, policy, and practices, that we're tracking and using real-time data so we can make quick pivots if needed, that there's transparency in the system, that there's data and reports that are shared and disseminated broadly, and that there's ongoing care pathway development, meaning we're continually assessing families' experiences to and through the system, and we're identifying new places and new ways to make that experience better. And that's what we're trying to do. And so with that, we have our technical assistance timeline, and we have I needed Lisa's help. So July, like July we're in right now, right? Through December, we are going to partner with as many of you out there as want it and want to chat with us about it around the SRSI. We've already started with the state system, and they've shared a lot of documents and given us a lot of things. And so we're going to review with SOCAC and the local systems of care and the tribes. And so that July to December timeframe is when you can opt in to this process.
Although
right?
we want you to opt in sooner than later, because we have to be done by December, and we want to,
Yes.
we would meet with you. We're going to gather a bunch of documents. We're going to dig in and read. Then we're going to work with you in scoring your SRSI and pre-implementation. So don't like hold off until Thanksgiving and say, hey, I want it. Better.
This is true. This is true. Please don't do that. And then August through June, and this is a large time frame. There'll be trainings and technical assistance in collaboration with current partners, including monthly TA for SOCAC, grant writing, things like that.
This
And
is
then
your wish list. You let us know, and you'll identify topics as you really take and go through the SRSI with us.
Yeah, absolutely. And then from January to June, so this is January 2024 through June of 2024, we're going to present to the SOCAC and develop action plans linking to the Medicaid review that's already started and moving forward, and around prioritizing indicators and helping create those next steps for what does that look like. And so that's kind of our timeline. And then we wanted to also give you some contacts. And so this presentation, I think actually it was already attached to the invitation.
Yep, it
And
was.
I feel like the recording is going to be available for people. So, you know, there is our contact information. And, you know, so we want to hear your thoughts and, you know, kind of what's going through your head right now. But we really do want to invite you all to participate. We would love to get to know each of you and the local system of care sites and the tribal nations. And, you know, let's dig in and let's see.
Take down the slides so we can see.
Okay. Okay.
So,
There
and
was,
talked to Denise and Kim, and I just want to say this for everyone who's in the room. For if that we may decide to kind of cohort people, that some systems of care might be really great at something that they want to work with somebody who's struggling on it, and that we're building relationship between tribes and their local system of care partners, or local systems that are near one another or far away from one another, right? That we can be facilitating connections across Oregon through this process as well. Maybe we have some folks that are really wanting to work on one particular indicator. And so we're calling those folks together into a group to process and plan for how they might make movement on that indicator. So there's going to be intentional connections built between the people in Oregon who are doing this work, so that when UConn has completed their contract, we all still have that shared capacity within one another and within this learning collaborative community.
Absolutely. And I think that it's also about coming to the table with, you know, with an openness and a recognition that everyone wants to make things better. And it's not a locals trying to do a aha gotcha for the state of this is our barrier, or the state saying, oh, you know, local folks. But it really is like, where are those places that we can leverage the strengths that people have? Where can we put people together that want to grow in the same direction? And how do we start to pull it all together? So it's very, very exciting, actually. Okay. So questions. I think someone wants to know, what's the process for expressing interest in participating?
and Christy, I believe you're going to put our contact information up on the website. The process is to contact Kim and me, and we'll make sure you have our contact information. Kim and I aren't going to do them all. We are going to have a team of people, so we'll be assigning some of our staff leads who are very familiar with the tool to be working with some of the sites. And there was a call out, a request for the link to the SRSI. It's not online because it is proprietary and it's copyrighted, and it's only for folks who contract with us who get to see the tool, but we'll make sure it gets out to all of you. And I think actually, Anna and Christy, it may have been, was it disseminated to the SOCAC and not yet this group? Okay.
Christy and I have a copy of it. We were not sure if we could share it with folks, depending on whether they had opted in or not, right? So we were going to wait until we had a conversation with you.
Yeah, for sure. And if questions come up, like, please, you know, ask. You can reach out. Our emails were also in the chat. They're in the end of the PowerPoint presentation that was attached. The slides were attached. And then again, Christy somebody is going to update. Christy is leading the charge for that website update around our contact information too. So. And
then Sandy asked in the chat, what other states or communities have done to address eligibility criteria? Pointing out that seems to be a particular barrier in her experience at Oregon Family Support Network.
Well, it really, eligibility criteria for what, right? So part of what we have to see is what's your service array look like, where are we not hitting the mark, like the example we had with the other state where wired 9-year-olds, the ones that are being discharged. So it's looking at the what that you have and what are your eligibility criteria. I'd also challenge you just a little bit as a group to look at your population of focus, and maybe it's not youth who have already multiple contacts with the state's different child family serving systems, but maybe it's earlier up in that prevention promotion continuum, which is the magic again of mobile response and stabilization, because there is no eligibility criteria. You call, you get a response.
Yeah. Were there other questions in there? I didn't, I haven't, I mean, I see it now, but I didn't, it's a lot in there.
We were addressing them as we went along.
Oh, okay, good.
There was a shout out about collecting more qualitative data to truly understand the value and needs of the family. And I completely agree, qualitative plus quantitative. And, you know,
Absolutely.
we read, Kim referenced it, but when we read your appendix D and E, we were just, goosebumps doesn't, it was so articulate, so well done. So kudos to the families who participated and pulled that together. Same with the last appendices with Youth Era too, but there was a lot of thought put into those convenings, those quotes, those stakeholders and messaging. And so we thank you. It was very inspirational for us to every now and then be reminded once again so articulately why we do this work. So kudos.
It is hard. It takes time. And I mean, just like you all kind of get marred down in it, we do too. And it's like, oh, you know, it's so hard. And then you read something like that, and it's like, whew, this is why we do what we do.
Yeah.
And so it invigorates. And sometimes when you're in your own state, though, it's kind of like, ugh, and
You
it's
get
heavy
stuck
and
in
you
that.
don't really have the,
Right.
you know, that opportunity. So we will have opportunities too, I think, for maybe some peer-to-peer exchanges as needed and things like that too. Because I do think that that's really helpful to know that others, you know, have gotten through some of the pieces and so on. But it was really moving.
It definitely was. And so Kim confessed that she's a clinician. I need to confess that I'm a lawyer. You put a clinician and a lawyer together, and that's why our tool is actually built on indicators that work for systems. So you're not just again throwing spaghetti on a wall and seeing what sticks. There's science behind it. It's all based on good and modern systems. So those indicators are supporting the work that you need, and it helps you be strategic about selecting what you're going to put in your strategic plan.
Any other questions? Okay. I would just again invite you all to participate and, you know, be a part of this process. I think we're fun. I am a little corny sometimes, so I'm just gonna put that out there that it'll happen. And but it's, you know, it's good work, and we would like to meet.
We also believe firmly that it's hard work and a sense of humor goes a long way. So I don't know if you remember this, Kim, but years ago, I had to facilitate a large strategic planning session with results accountability for the state of Maryland for the Children's Cabinet.
Yes.
And the meeting was on Halloween. So I went dressed as a victim of bureaucratic red tape. I was the facilitator. I got black slacks, a black top. I got red duct tape and wrapped it around, and I
do remember that.
The plastic chicken wire, and then bloody tattoos. So I went as a victim of bureaucratic red tape. I can't tell you whether or not I got rid of any red tape that day or not, but it was humorous.
Christy?
Yeah, I really appreciate that story. Years ago, for Halloween, I went as a bureaucratic buster. What I think that was the name I gave myself.
We should go together.
I was pregnant, and so I had this huge belly, and I had chains, and anyways.
Love it.
One question that might be on the minds of people here is kind of like, what is the time expectation? If a local system of care said, yes, we're all in, we want to do this, how much time would you estimate they would spend all over the next 6 months to a year? Kind of, you know, it sounds like going through the indicators is a bit of a conversation and the prioritization. And
yeah, I think that the more information that we can get, the better. And it's not like we don't want to be buried in a lot of documents, but the things that are really important are any local contracts, policies, strategic plans, any of those kind of big, you know, kind of broad documents that you might have, or work that's being done cross-system initiatives or grants or things like that.
Operating procedures.
Yeah, that kind of stuff. So the more that you can kind of pull that together and give it to us, I think the faster it can go too. And then I would say it's probably maybe a couple of hour conversation, or maybe 2.5 hour conversations, just to get everything scored and, everyone agreeing to here's kind of where we are. And then I think, it depends on
How deep do you want to go?
Yeah. Super. But that's kind of that initial investment, I would say. If we get a comprehensive document review, we can go ahead and pre-score, we can add notes, we can do things that then, create a more rich conversation than literally like, number one, what do you think? It's not that kind of thing.
The other thing is, you may decide in your local council or your tribe that you want a small group, maybe 1 or 2 individuals, to work initially with us and then pre-score with you, and then you vet it with a larger group so that we could help you do that, and then a larger presentation. So we're going to go at the pace and the depth that feels most comfortable to you.
Yep. I think we have 2 minutes to spare. 2 minutes.
I was going to say we have 2 minutes left. Is there any final burning question? It doesn't have to be super burning. It could just be like slightly warm.
Actually,
Shelby.
hi. Yeah, I had a question. So I'm the local coordinator for the Portland metro area. And but so it's not clear to me kind of how this all fits in with the CCOs, who are such big movers and shakers for a major component of the system of care, which is all our behavioral health work. So I guess I'm a little bit curious about and there's probably not time to answer it. And then the other question I had, maybe these can be addressed in email, is just, I think that out of our local systems of care, there's at least 4 of us that have either recently completed or are in mid-process in creating strategic plans. And it's not quite clear to me through the presentation today, kind of precisely how this SRI could be brought in mid-process if a system of care is in mid-transition, which is the case for me in Metro County, or if they've already established their new plan and are starting to work on implementation. So I don't think you can address that in the 1 minute left, but maybe that's something that could be addressed in an email perhaps. But those are kind of 2 lingering things that are coming up for me.
So I would think quickly, the CCOs should be part of your team that we're working with. They're a vital partner. They should be part of these conversations, as should your family and young adults in your community. We'll meet you where you are, Selby. So if you have a prior plan, we'd love to see that. If you have pieces of a current plan, we'd love to see that. And then it's up to you as to how much you want to use the SRSI to actually change or complete your current strategic plan and or address it in your next iteration. It's all up to you. The magic is being able to collect those indicators and marrying you up with other sites that are struggling or wanting to address the same indicators, as well as setting up those mentor communities, and then actually also aligning with the state work as well. None of this happens overnight. You guys have been doing this for so long, you know this. We're just trying to give you some concrete care pathways to work on. Well, thanks again for having us. We do appreciate it, and we really look forward to working.
Thank you so much. Lots of excitement and enthusiasm in the chat for you all. We will be in touch with slides and recording and contact. And yeah, hopefully we will see you next month at the next System of Care Learning Collaborative. Thanks so much, everybody. Have a great afternoon.
Thank you.
Thank you.
Have a good night.
Bye-bye.
Bye.